Schaumburg Police Department will soon deploy a mobile response unit with one police officer and one social worker to answer 911 calls involving mental illness and substance abuse issues. All too often, those encounters can suddenly turn deadly. A few months ago, Chicago police started a similar, very small pilot program. Schaumburg is paid for entirely by a federal grant obtained by Congressman Krishnamoorthi. He joins us now from Washington, D.C.
You know, I don't believe in defunding the police. I think we should invest in police departments so that they have the capabilities to do what we're trying to do here, which is, you know, we want to take police officers individually out of the mental health business, Mike. That's not what they're really equipped to do. But we can then pair them up with other resources so that they are kind of meeting people where they are and dealing with the situation so it doesn't escalate out of hand.
So how often is this an issue in Schaumburg, which is your hometown? The Schaumburg Police Department obviously thinks it's important enough to start this unit. How big an issue is it in a suburban community like that, part urban, part suburban?
I think it's an issue everywhere, and I think that it's an issue that unfortunately doesn't get discussed very much. Oftentimes we read about these situations in the newspaper the next day, but by that point they've unfortunately escalated to a violent confrontation. There might even be gun violence. And so what we're trying to do here is we're trying to de-escalate the situation by bringing mental health resources to bear early on when it could really count.
All right, so as I understand it, the Schaumburg Police Department is organizing this, but it also, several other neighboring villages are involved, Elk Grove Village, Hoffman Estates, Arlington Heights. They're also bringing some resources to bear, and this will become a regional thing for responding to these kinds of crises?
It could. I mean, what we're doing right now is we're funding a pilot program, Mike. And the hope is that we see results that are positive and that are kind of replicable in other places. Elk Grove Village, by the way, does a wonderful job dealing with substance abuse issues. They believe that, the city should, or the village of Elk Grove Village should basically intervene and help people with their substance abuse disorders so that these people don't become perpetrators of crime. And I think it's having a lot of success. So there are a lot of interesting experiments going on in the Chicago region, and I'm so happy to be a part of it. And if we can get this right, I'm really excited about what we can do elsewhere.
So how much money would it take to expand this to a much larger arena, the city of Chicago, the Chicago PD, with 10 or 11,000 officers with a number of vacancies, obviously is a different scale of magnitude. How much would that cost?
I don't know, Mike. I think that it would obviously, have to kind of scale up to match the magnitude of the challenge. But what I'm hopeful about is that we can glean lessons here that we can apply elsewhere, including in Chicago. And, I have to tell you, I interact a lot with police officers, and quite frankly, a lot of them see this kind of mental health issue every day, as you mentioned before. And unfortunately, their pleas for help to assist with these mental health issues have gone ignored, certainly up till now at the federal level. And so we're starting to kind of deal with this and hopefully make a difference.
Well, the Cook County Sheriff talks about how the county jail is the nation's largest mental health hospital. Literally thousands of mentally ill people are locked up there.
At one time, there was a system of institutions, mental health institutions throughout the country, and for various reasons, we decided that that was perhaps not the best way to go in terms of treating mental health disorders, but we didn't then provide other services to deal with the underlying conditions that people suffered. So a lot of these people ended up on the streets. They're homeless, or they have disorders that cause them to be violent. And unfortunately, the police have to deal with that. And when the police are dealing with that, they can't deal with certain other challenges that we want them to deal with.
So let me switch gears, Congressman Krishnamoorthi. You're chairman of a subcommittee on economic and consumer policy, and you're looking at digital privacy issues. And it's been sparked by the Supreme Court overturning Roe versus Wade.
It turns out that millions of women entrust their private, personal, reproductive health data to big technology companies who have these apps that help them with their reproductive health. And unfortunately, what we found, or what we know, is that a lot of these companies then monetize that data by selling it to third parties, even sharing it with law enforcement. And so what we did was we launched an investigation to find out what these different data brokers and what these app companies are actually doing in terms of their policies. How do they collect and retain and protect the privacy of that data? And if they don't, with whom do they share that data? Because it's really important that women and anybody who use those apps are able to get full transparency as to what's going on. Separately, we've also initiated legislation to protect that privacy going forward.
Well, if a law enforcement agency delivers a subpoena to Google or somebody and says, let's do some data mining and we'll check some of these apps, and then we'll look for Google searches for abortion, that they could easily end up arresting somebody or prosecuting.
That's right. And I think that what we want to know is, what kind of data is actually retained, because in some companies' cases, they actually either destroy that data, they encrypt it, they anonymize it, they basically make it impossible for others to trace that data back to a person. And so what we want to understand is, what are their policies in this regard, and have they changed those policies going forward?
And finally, I'll let you go in a minute. I know you're busy there in Washington, D.C., but when you went to some of the countries that border Ukraine recently, you sit on the Intelligence Committee. What's your sense of the way that war is going?
Ukrainians are very rapidly deploying very high-tech and sophisticated weaponry that we are providing to them and using it to great effect. For instance, the HIMARS, which is the high-mobility artillery rocket systems that we've provided to them, have inflicted deep losses in their ammunition depots, their command posts, as well as their radars, far from the front lines. So although right now the Russians might be gaining in terms of the everyday artillery struggles and their incremental gains, I still feel good about the Ukrainians and their ability to basically outlast the Russians, provided that we continue to stand strongly with them. The First Lady of Ukraine actually addressed members of Congress on both sides, and it was a stirring address. She used powerful visuals to show children, families, elderly people who were basically slaughtered by the Russians in indiscriminate, reckless, and I think at this point, intentional attacks to try to inflict terror on the population. But what Putin does when he does that is he actually hardens our resolve to support the Ukrainians, and I think he actually increases the will of the Ukrainians to fight.
All right, Congressman Raja Krishnamoorthi from the Northwest Suburbs, thank you very much for joining us.